Thank you for joining the seminar. I would like to introduce myself briefly. My name is Caroline Moos. I work for SHE, which stands for the Schools for Health in Europe Network Foundation. This network consists of coordinators and researchers which work with school health promotion. I work at the Secretariat, which is based in Denmark, and we work to provide a European platform for school health promotion. Using the knowledge from this network, I'd like to talk to you today about the emotional needs of children in the times of a pandemic. The network consists of 40 national coordinators across European countries that all work with school health promotion. We also have a research group that consists of 97 researchers from 24 different countries. We have new members that join each year, and we're currently working with both England and Northern Ireland in relation to membership. If the country you represent doesn't have membership, please contact me and I'll be interested in helping you work out a way to establish that. Or if you're unsure as to who your national coordinator is, you can also contact me. I can't go past this slide without saying that our network is supported by the WHO and by the European Commission. This slide is from our website and it indicates all the countries of which we have national coordinators from health promoting schools. Before I begin, it's important that we have a common definition, a common understanding of what a health promoting school is. And SHE regards a health promoting school as a school that implements a structured and systematic plan for the health, well-being and development of social capital of all students and of teaching and non-teaching staff. I've tried to represent that in the picture here. The health promoting schools is not simply about individual health skills and action competencies, as you can see on the right hand side, but it involves a whole school approach. It looks at the children and their environment. So it's really important that we have participation, for example, from the children in establishing a health promoting school. It's also important we have community links also to health services. We look at the school physical environment and social environment and the policies the school has. So when we're talking health promoting schools, we're talking a whole school approach. There's no doubt that this pandemic has affected many children. Over 1.3 billion children globally have been affected. We've yet to research particularly the long-term consequences in depth. But we know that globally, more than 400,000 people have lost their lives. So children, they've lost parents, grandparents and relatives. But what is undeniable is that the negative effects are more probable for disadvantaged and vulnerable children. We need to keep an eye out that our support strategies particularly are aimed towards the disadvantaged. So what affects the emotional well-being of children during a pandemic? Some things are more obvious. A loss of income that results in dramatic changes in a household. Lack of intergenerational social contact, also very easy to see. There is often a lack of opportunities for socialising with peers and a lack of outdoor activities. These things affect emotional well-being of children, but there are other things that are less obvious. And they're the ones I've pointed out in this slide. Parents have been more stressed during the crisis, particularly parents that struggle with illness and addictions or other conditions which worsen under, for example, lockdown. Family dynamics may become more difficult and tense during the lockdown, and in particular, some parents may be traumatised, for example, medical staff working in hospitals, or people who are grieving. If we're talking about facts, these facts are taken from a survey by Save the Children, and I've taken I've looked at the European facts. So in Finland, 70% of the children surveyed experienced anxiety and 55% fatigue. In the UK, 20% were worried about the future due to school closures, and 60% were worried that a relative might fall ill. In Germany, 33% worried they may not be able to finish the school year, and in Spain, over a quarter of parents with lower income reported higher levels of distress than normal. Many reported children were struggling with fear, anguish, and concern about their family situation. These are all emotional effects of children. So what do we need to do? We need to allow for transition time. Don't rush back into the routine as if nothing ever happened. In schools, we need to allow time for discussion about this unique thing that's happened in society. We need to focus on the whole school environment. What do I mean by this? We need to look at everything, not just, for example, whether children have enough access to physical activity, but also whether they have access to clean water, whether the optimal sanitation is provided in the school. Can we improve indoor air circulation? Do we provide them with less crowded classes? We need to pay attention to the socio-ecological aspects of health promotion. And what do I mean by this? We need to foster a sense of social connection, a sense of caring for others, and in particular, the vulnerable in our society. And lastly, we need to integrate knowledge about COVID-19 in all subjects at school. By doing this, we focus on developing critical health literacy, which is required for children, particularly in relation to social media. These pictures are taken from material that have been developed by our member countries and shared across the network. The picture on the left-hand side is from Portugal. It's from material for Education for Health. It was organised by a group of secondary teachers. It was weekly material provided to the wider school community, so not just students, to keep them connected and healthy. It was designed to create a sense of laughter, connectedness, and inspire a sense of family. The middle picture is a symbol taken from material from Slovenia. Slovenia organised and encouraged online volunteers or mentors with their students. These mentors were used both to solve practical problems like homework problems or computer problems, but also used to help in relation to mental health, where children's worries were discussed in terms of the family or financial situation. On the right-hand side of the slide is from material from Lithuania. This was for kindergarten children and promoted that parents and their children use time outside on a research project involving beetles, as you can see here. I'm well aware that not all children could go outside, but Lithuania had those opportunities. Other things we need to do to provide or meet children's emotional needs. We need to increase, refine and specify the social support within and between schools, families and the local community. For example, are teachers available if parents have questions? In Portugal, the school organised local businesses to support poorer students with a computer, for example. We need to improve collaboration between schools and local services. Do children have access to a good health nurse? Do you have a clear communication plan in relation to emergencies? In Hungary, a physiotherapist organised a broadcast on national TV in terms of activities they could do in the home. We need to have a differentiated approach to students with difficulties when needed. For example, has the school focused on subjects which we know parents have less of a capacity to help with when homeschooling? Do we provide extra help in that subject when children come back to school? We need to provide attention to play, outdoor learning and body movement. Does the school promote walking or cycling to school? And last, but certainly not least, is we need to remember to address inequality. Who needs more support? What kind of support? How do we give this support and when? This slide represents some of the resources that you can see or access online from our network. You do not need to be a member to access these materials, they are online. In particular, I'd like to point out that we have a knowledge sharing survey on the process of reopening schools. We'd like more people to participate. There's also a second survey that's specifically for school teachers. And we also have specific COVID-19 information in relation to case stories from different countries. We also have more general material available on our website. These include specific teaching materials, a school manual on how to become a health promotion school, and the standards and indicators of being a health promotion school. What are the indicators that we've reached particular standards? We would like so many more countries and schools to benefit from this network's expertise. The easiest way to do this is to subscribe to our newsletter. You can also follow us on our numerous social media platforms, Facebook, Twitter, LinkedIn and YouTube, and tell your friends and colleagues about us. The references that I've used for this small presentation are given here. I'd like to draw your attention to the fact that on our website we have a particular page in relation to materials that teachers and children can use in relation to the pandemic. Thank you for your time today. If you have any questions, you're more than welcome to contact me, and you can see my email address in green on this slide. And right at the bottom is our web address, and that is where you can access all the materials. Thanks for your time today.